Start.
Assalamualaikum. Assalamualaikum and good morning to everyone who are joining us today. Welcome to all school students, teachers, parents from all around Asia. Not forgetting all University Malaysia Sabah students and staff present in this webinar session. My name is Nurul Atira binti Rahman. I am from Fakulti of Engineering. Will be in charge as moderator for this session. Thank you, and we meet again for today's session of STEM Speaker Series. STEM Speaker Series is a collaboration between the U Science University Malaysia Sabah and My STEM Ambassador University Malaysia Sabah. For those who join us for the first time, this STEM Speaker Series is a co-joint effort with the Faculty of Medicine and Health Science, University Malaysia Sabah. This program is fully supported by the Sabah Ministry of Science, Technology and Innovation, aimed to deliver unique and interesting STEM topics designed by subject matter experts to increase the interest of school students, teachers, and also community to alike the entry in the field of STEM. For any question from audience, please feel free to drop your question on the chat box at the right side of this YouTube live station. Please be informed that for today's session, e-certificate will be given to school student and University Malaysia Sabah student. Therefore, I would like everyone to stay tuned to fill the form given through the QR code that will be shared at the end of this webinar session. So without further ado, I would like to introduce our speaker for today. With us is a distinguished academician from Faculty of Medicine and Health Science, Dr. Eugene Wong. Dr. Eugene Wong is an ear, nose, and throat surgeon, also a senior lecturer at University Malaysia Sabah. Dr. Eugene graduated from University of Aberdeen Medical School, Scotland in 2008, and he also worked in the UK for 6 years in a different hospital in Scotland, England, and Wales, where he also obtained a Master of Philosophy degree in Rhinology Research from Cardiff University. He then completed his higher surgical training in ENT at University Malaya, Kuala Lumpur, and University Hospital Basel, Switzerland in 2018. So without further ado, please welcome Dr. Eugene Wong with his topic entitled Ent Foreign Body. So Doctor, please be invited.
Thank you very much for your kind introduction. So I hope you can see my slides. So again, good morning, everyone. My name is Eugene Wong. I'm an ENT specialist from Faculty of Medicine and Health Sciences, University Malaysia Sabah, UMS. And I hope everyone is well and healthy today. So first of all, I'd like to thank the U Science UMS for inviting me to give a talk on Ent Foreign Bodies today as part of your 3S STEM Speaker Series program. So I have 3 things that I'd like to cover today. So number 1, why is this an important topic? Number 2, how do you diagnose them? And number 3, how do we manage the patients? So let's get started. So foreign bodies in the ear, nose, and throat, it is an important topic because patients can get infections and discomfort and pain from having the foreign bodies in these cavities. For example, if an insect fly into your ear and it's biting your skin and try to crawl around and fly around, then it's going to be very painful and distressing for the patients. And therefore, they need to be removed. The second thing is because depending on the type of foreign bodies that has been inserted into your ear, nose, or throat. So one of the particularly dangerous foreign body is button batteries. So you can find it's the small round batteries that you can find in watches. So in this picture, it's like the remote control or in toys. So children likes to take those small battery and then put them in their mouth, in their ear, in their nose. So all of this, so this is very dangerous and needs to be taken out immediately because once it's in contact with your mucus or saliva, and it will start to leak the alkaline into the surface, and that will cause a lot of destruction and corrosion of the surrounding tissue. And of course, another thing is particularly relevant to basically children choking on food. So normally it's something that is round. So for example, if they're eating a grape or something with a seed in it, they can accidentally choke on the food, which goes into their lung. And then, so this is actually the sixth commonest cause of accidental death in children, where they basically choke on their food and unable to breathe after that. And that's why this is a very important topic for parents and for everyone to know. So as I mentioned, having foreign bodies in your ear, nose, or throat is usually more common among children. Just because they are still young, they have the habit of just grabbing anything they can find on the table, on the floor, and start putting them into their ear, into their nose, into their mouth. And also, children are usually quite easily distracted when they are eating. So, for example, they might be running around, chasing each other, or they can be laughing and playing while eating. So this can be quite dangerous because they can accidentally swallow the food, and then the food might go into the lung instead of going into the stomach. Another reason is because children, normally their teeth are not fully developed, so they can't really chew their food properly when they are eating. So therefore, there are still chunks of food, and when they swallow, it can also accidentally go into their lungs. And finally, because they're still young, so they don't have a lot of experience in swallowing food yet. So again, increase their risk of choking on the food. For adults, usually it's unlikely for them to, it's quite rare for adults to put stuff intentionally into their ear or their nose. So one of the things that can happen quite regularly in adults is either an insect fly into your ear and unable to come out, or maybe so another common thing that we see all the time is adults using cotton bud to try to clean their ear, and then they accidentally leave a bit of cotton bud behind in the ear, and then the cotton bud becomes infected and causing all the problems. For the throat, the common things that happen, the common foreign bodies for adults is number one, bones. So, and especially fish bone. So you can see, let me show. So on this arrow, you can see that there's a small bone coming out from the tonsil. So this is quite a common location. So especially in Asian countries where people like to eat fish that has bone in it instead of eating fish fillet, and therefore the bone can get stuck in the tonsils, in the base of the tongue, and every time you swallow, you can feel there's something sharp in the throat. Another common thing for adults to swallow is a chunk of meat. So sometimes maybe they don't chew enough, and therefore a big lump of meat gets stuck in the esophagus, in your food pipe, and then completely block it off. And after that, when you try to eat anything or drink anything, it gets stuck and you have to vomit them out. So these are the common things for adults. So how do you recognize someone have a foreign body in their ear, nose, or throat? So for adults, it is usually quite more straightforward because they can actually talk to you. So they'll tell you what happened. So maybe they said they were eating fish, and after that they feel something stuck in their throat, and since then they cannot swallow, or every time they swallow it's very painful. Then you can kind of predict that this probably is because of fish-borne, or they can tell you that they've been using cotton bud a lot, and when they take out the cotton bud from their ear, they found that the cotton part is missing, and so most likely it has been left inside the ear. But for children, it is more difficult to diagnose foreign bodies because number one, if they are very young, they cannot really tell you what happened, or they can talk, but they can't really explain properly to you what they've done. So the best case scenario for children is usually if when they put something up their nose and their older siblings saw it or the parents saw it, and then at least that something is inside their nose or their ear. Another common way to find out is sometimes the parents will say they look at a toy or look at a necklace or something, and they find that, oh, parts of it is missing and they cannot find it anywhere else. So they will start to suspect maybe the child has been biting it and accidentally swallow it as well. So in terms of foreign body in the ear and the nose, if it is something that is organic, for example, food particle, like so common one like peanuts that they like to put in their nose. So this kind of material, they can easily become infected. So once it's infected, you will get it's becoming very painful. You get pus coming out, and sometimes there's bleeding. And if it's in the ear, you may not be able to hear very well because it's now completely swollen inside. If it's but for aspiration of foreign bodies, or if they choke on, if they accidentally swallow like a small food that goes into the lung, sometimes it's very difficult to diagnose because patient can be asymptomatic. They may not, they can be just completely fine. So, and the symptoms are very non-specific. So sometimes you just need to ask whether there's any choking episodes. So maybe they were playing with a toy and then suddenly they felt like, oh, they can't breathe. And then after that, they are okay again. So you have to then suspect maybe it's a very small thing that has entered into the lung. Other ways they can present, they can have coughing episodes, wheezing. So wheezing is like asthma, or they keep getting chest infection because there's something inside their lung, which no one realized. Okay. So what are the signs and symptoms? So I've mentioned earlier, if it is in the ear, it is usually if it is an organic thing, for example, like insects or peanuts, or even if it's a cotton bud that's left inside the ear, it can become infected, and therefore you get this pain, decrease in hearing, pus coming out, the skin becomes infected. But sometimes if they put something like a bead inside, or sometimes for adults, maybe their earring accidentally fall into their ear because it's made of metal or platinum, gold. So those things don't normally get infected, so it could be hidden inside for a long time if it doesn't cause any pain. For the nose, again, it is similar to the ear. You usually will get some kind of symptoms once it's infected. So things that children likes to put in their nose, again, like fruits or food or peanuts, they stuff it up their nose, and then after a while it becomes infected. So suddenly you see there's like smelly discharge coming from the nose on one side. Sometimes there's bleeding, and then you need to get it looked at to see if there's anything hidden inside the nose. However, for foreign body in the throat, in the if in the lungs or in the windpipe, in the trachea, so that one depends on the location of the foreign body. So if it is in the vocal cord area, around the vocal cord, the child may come in with hoarseness of voice, noisy breathing. Sometimes maybe there's blood when they cough. If it is further down in the lungs already, then they might have a lot of coughing, wheezing, like as if they have asthma, or they have blood in the when they cough, there's blood coming out in the mixed with the sputum. And when you examine them, they then again wheezing, so which is why a lot of children who accidentally choke on food, they sometimes are misdiagnosed as asthma or misdiagnosed as chest infection. And after they treat with antibiotics, it's still not improved because, or they were given asthma medication and it's still not improved because they've missed this foreign body inside. And quite a lot of time, patient can be asymptomatic as well, even though there is something that they've accidentally aspirated. So why do children normally get a delay in diagnosis? So the common reason is if it is unwitnessed by anyone. So same point as what I mentioned earlier. So if they are left alone, maybe they were playing by themselves and parents or siblings didn't see it, because sometimes children will have delay symptoms, i.e. They maybe after they have accidentally swallowed or choked on something, they will be fine for a period of time, and then after that they start to develop symptoms such as difficult to breathe, wheezing, keep getting chest infection, and at that time, because it didn't happen immediately, therefore people don't really suspect maybe it's related to something that happened a few days ago, for example. But if you leave it alone, it can cause a lot of other problems. For example, keep getting chest infection, lung collapse, emphysema, and even death if untreated. Okay, so once we see the patient, normally for foreign body in the ear or the nose, we can normally quite easily diagnose them with just a endoscope. So we put a camera into their ear, put a camera into their nose, then we can see, oh, there's like something round, there's a metal thing, there's a plastic thing, then we can take it out. But if it's something that is in their lung, it's normally more difficult. The first thing we do is normally a chest X-ray. So, so the first picture, you can see there's there's a plastic thing in the right bronchus that goes, and beyond it, you can see that there's the lung has collapsed. There's no air beyond it because air cannot go in past that object. On the other picture, you can see one side of the lung is completely collapsed. Only one lung is working. So this patient actually have a peanut lodged inside the bronchus on the left side. And so if it's a peanut, if you X-ray, you won't be able to see the peanut because it's not a radio opaque material. Same as a lot of fishbone as well. Not all fishbone can be seen on chest on X-ray. Some of them it's a bit transparent, and therefore you X-ray, you can't really see them. Okay, so I will just show you some pictures of what we do. So these are just some videos that I found on internet to show you how we remove different things from the cavity. So for this one, show. Okay, so this is for the ear. So you can see there's something inside the ear. So we normally use a crocodile forceps to take it out. And then you need to check and make sure there's nothing else and everything is fine. So you can see here the eardrum is still intact, there's no infection. It's another child. You can see they've put something else inside. Then we can take it out. Okay, and then it's I think the next few videos are about it's cotton buds. Yeah, so you can see it's so some cotton buds, it's especially maybe the lower quality one, the cotton part is quite easily just come out from the stick and being left inside, and they normally get infected quite easily. So you need to take it out. And if there is infection, we need to, after we take it out, we need to clean it and then give antibiotics eardrop. And sometimes you can see this kind of situation where sometimes the child has been every day taking one small thing and keep putting into their ears as well, and end up having so many things inside their ear. Okay. So the next one is the nose. So this is the nose. So ear and nose are usually we can take out in with patient awake, unless the child is very, very uncooperative. So I think in this video, they put the child to sleep under general anesthetic. So this is a bead, like, you know, to make like necklace, that kind of thing, which is also very common for children to just pick up from the floor and then put it in their nose. And then they found there's another one behind. So that's why we need to always so normally in the clinic, if we see a child with foreign body in one nose, for example, we always need to check the other nose, and then we need to check their ear also, because if they are the type who likes to put things in their ear or nose, then you don't want to miss something else. So normally we would check every place to make sure there's nothing else that maybe you don't know that they have been putting. Okay, and then the next few slides I'm going to talk about basically what to do for patients a child who chokes on things. So we can basically divide them into whether they can cough it up or they cannot cough. If they cannot cough, whether they are conscious or not. If they are conscious, normally we give 5 back blows and 5 chest thrusts. Or in adults, normally you do the Heimlich maneuver. I'm sure you've seen in movies where we go behind them to try to make them cough out the food. If they're unconscious, you need to start your CPR because that means air is not actually going into the lungs, it's completely blocked, and therefore you need to help them survive while waiting for ambulance. You need to do a CPR. In very emergency, in an urgent situation where they cannot breathe, then if once you arrive at the hospital, we will need to make a small hole in their neck to allow us to put the tube into their the trachea so that they can breathe first before we then go and look for the foreign body. So normally it's either a cricothyrotomy, so that one is easier, or a simpler process to do. Normally the anesthetist or the emergency department doctor can do, or a tracheostomy, which is what ENT surgeons will do. So make a cut and then put in the tube so that they can breathe first, and then only you look for where is the blockage. And so the definitive management to take out is normally what we call a rigid bronchoscopy. I will just show you.
Welcome to our instruction to the airway.
So this is
If foreign body removal is being performed, the next step is to disassemble parts of the scope. The Hopkins rod is removed.
So basically this is the instrument that we use. So this is the entire instrument. So this is your camera for us to see inside. This is for the gas, anesthetic gas, for them to be able to to keep the patient asleep. And then you have this thing to grab the foreign body. So I'll just show you a video. So this is basically, so this is your vocal cord, and then this is your trachea, and then into the bronchus, and you can see there's a whistle, there's a plastic whistle that the child has accidentally swallowed and go into the lung. So this whole entire lung is blocked off already. And therefore, we need to take it out. Okay, so that was what was inside the lung. Okay, so just last slide. So I don't know if you've noticed, there is actually a hole on top of the pen cap. So back in 1991, because in the 90s there was a lot of children, or a lot of deaths from swallowing or aspirating on the cap of the pen, and therefore the company that makes the pen, the ballpoint pen, starts to make a hole at the top, so that because what happens is, I think either children or adults, they like to chew on the pen and then accidentally swallow it, and it will block off your trachea, then they cannot breathe. So they make a small hole so that if it really did accidentally get swallowed, you still have a bit of time to breathe, where you can get help. But this hole can easily be blocked off by blood, by mucus. So it's not a completely safe thing, but it gives you a bit of time. So you still need to take it out quickly. Okay, so that's everything from me. Any questions? So thank you very much for listening. So that's all my presentation.
Thank you very much, Dr. Eugene Wong. It was a very interesting and wonderful topic. So I will start the first question is about someone are asking about if
I think the
oh yeah, there's a question at the comment section. Doctor, can you answer and let the curiosity of our audience to be answered?
Which question? Sorry. Okay, I'll just go through the chat on the YouTube. Yeah, okay. So Hakimi Irwan. So normally I'll speak in maybe in BM. So usually if kalau kanak-kanak selalu ada satu belah hidung ada keluar bau busuk, then memang biasa kita mesti make sure bukan foreign body dalam hidung until proven otherwise. Karena itu yang biasa berlaku lah. Mereka letak sesuatu dan kamu tidak perasan. Lepas itu dia sudah ada jangkitan dan tiba-tiba satu belah hidung ada nanah keluar macam itu, dan biasa kena pergi check, make sure tak ada macam makanan ke apa-apa yang mereka letak dalam hidung. Let me see the next question. Okay. Yeah, okay, so you've answered.
Okay, for the next question, sir, it will be from me because I'm the. I want to ask about the. I have the curiosity about when a child like around like 3 to 4 years child, they tend to play with like clay. So
Okay.
doctor, you know what a clay something is it? It's contained too many straight up. What is it called? Like a chemical. Is it affect? Is it? It's really foreign to body and it will cause infections. But is it like how can we say it? Like is it can be treated through like uh our own self treat the child instead of go to the doctor, or is it
You mean like the
need to go to the
clay,
doctor too?
clay, yeah, like the Play-Doh, like that can. Do you mean the clay? So normally we see this kind of things in the ear, in the nose also. So like those like crayon and or clay that you play. If they put inside, actually it's quite difficult to take out because you grab and then you will just like keep uh disintegrate like into very, very small pieces. So that one needs a lot of time to slowly remove it and then wash the area with water after that to make sure all the stuff are out. Yeah. So if you see inside the ear, you see, oh, there's some color in it, better to go to ENT and then we can check properly and take it out.
Okay. Okay, so I'll there's also a question from Siti Nadira. It's about if parents become is there any like law or something that will um judge the parents if they still ignoring their child, ignoring what happened to the child, if they become irresponsible parents? Is there anything that um doctor or their family who can like discover what to do and everything? Is there?
Okay, so that's a tricky question. I think you have to see the whole picture lah, and then I think normally if we suspect something, normally it's not just from one aspect of the child. So if you see the child, we normally have to assess whether this is really the parents neglecting the child, or maybe they really didn't know about it. So all these are quite a tricky area. So normally we need to involve a few other doctors like pediatrician, and then we need to talk to the family and see the ones that can happen regularly. Maybe if you see, oh, it's the same child, every month will come in one time with like something happen, then you're more suspicious. Then you need to then refer to pediatrician, the children doctor lah, to see. Then they will also want to be involved before we kind of start accusing parents that, oh, you're not taking care of your child. So it's we have to see the entire picture lah, rather than, oh, just because the child has something left in there for a few months, then we just assume that, oh, no, the parents don't care about the child. So you have to see the whole picture. Yeah.
Okay, doctor. So this will be the last question from Salina Muhammad alias. I'll just read it in Bahasa Melayu. Is it okay, doctor?
Yeah. Boleh.
Okay. So, Salina bertanya tentang dalam hidung dia selalu ada benjolan. Kalau macam bila selsema tu kan kita biasa kalau selsema senang mau keluarkan lendir hingus tu, tapi ini dia ada benjolan dan menyebabkan lendir tu susah untuk keluar. Ada kaitan ke tu dengan Ent Foreign Body, doktor?
Uh, biasa yang benjol tu kamu nampak sendiri ke atau bagaimana kamu tahu ada benjol? Is it kamu tengok di cermin nampak
Men-
ada? Kalau biasa ini bukan foreign body yang ada banyak hingus, banyak macam gatal hingus, lepas tu bersin banyak, especially mungkin terdedah kepada sejuk ke ataupun terdedah pada habuk ke, bulu ke. Dan ini biasa ialah allergic rhinitis lah. So ialah kamu sensitif pada sesuatu, kamu alergik pada sesuatu macam perubahan cuaca, perubahan suhu atau habuk. Dan dia punya dalam hidung tu dia ada banyak reaction, jadi keluarkan banyak lendir dan hingus dan dia jadi lebih kembang lah. So yang itu biasa bukan foreign body, itu memang anatomi dalam hidung tapi dia jadi kembang, jadi bengkak lah. So biasa kita akan bagi spray hidung untuk kecutkan dia dan juga ubat untuk yang alergik punya.
Oh, okay, doctor. Thank you so much, doctor, for answering audience question. We hope audience enjoy this amazing and interesting presentation. And also, the link for registration and e-certificate is now being shared for school student and University Malaysia Sabah student. Please fill in your details and also the simple feedback questionnaire. All students will receive e-certificate while SD point will be given to the University Malaysia Sabah only. Thank you very much again, doctor, for the time and for the shared about foreign body.
Thank you.
Thank you also to all the audience for your guys in the next STEM speaker series that will be scheduled on 11th March 2022 at 2:30 p.m. with topic about peternakan kelulut. It was a pleasure to have all you guys today. We conclude our webinar. Thank you for the cooperation and see you again.